Welcome back to Toledo Clinic TV. Our guest is Dr. Louis Tartaglia, and he is with us today to talk about the problem of sleep apnea. How common of a problem is this in our country?
It's probably 15 to 20% of adult males, a little bit less in females. It starts a little later in women because when they get into menopause, then they start to gain weight and they develop the sleep apnea. But we see it even in children.
Is it more common in people who are overweight? You said
yes, it is.
Okay.
And not only is it more common in people who are overweight, but the apnea itself causes you to gain weight.
Okay, and that's because you're not sleeping well and
you're not creating a hormone that allows you to feel full when you've eaten. That's Nesfatin 1. And if you're excessively sleepy during the day, you're less likely to exercise and you're going to become more inactive. So it's a vicious cycle where the apnea makes you more sleepy, makes you less likely to burn calories, and the increase in weight causes you to have more apnea. What happens is the throat starts to close down. That's obstructive sleep apnea. There's another type, central apnea, where your brain doesn't send a signal to your diaphragm to breathe, but that's another topic for another time. We used to think snoring was normal. When I was a kid, you know, the adult males in my family snored, especially the older ones. When they got into their 60s and 70s, they started to snore. But it's really not normal. You're supposed to have an airway that's open and your breathing should be effortless. Most people breathe through their nose. You're programmed by God to breathe through your nose when you're sleeping, but you start to see people who start to open their mouth when they're sleeping. It indicates that maybe they're having a little difficulty getting the air in. So what does it do? Well, your oxygen level drops as you start to suffocate while you're sleeping. That'll cause you to either wake up or it'll get so low that you suffer oxidative stress. In other words, your tissues have suffocated, they're getting damaged because of the low oxygen, and then your cells crap out cellular debris. They're called inflammatory cytokines because they inflame things. They inflame your blood vessels. When your blood vessels are inflamed, they suck in cholesterol. You get hardening of the arteries. That leads to high blood pressure, erectile dysfunction, heart attacks, and strokes. And that's why we treat the apnea, because we don't want that to happen. Apnea can also cause atrial fibrillation and flutter. It aggravates or even causes gastroesophageal reflux. If the inflammatory cytokines inflame the pancreas, you develop type 2 diabetes. So at the end of your life, you're a cardiac cripple with diabetes and you can't eat what you want, and you're tired all the time if you don't get your apnea treated. Getting the apnea treated really increases your life expectancy. It's really a wonderful thing that we have this ability.
So you mentioned snoring as a symptom of it.
Right.
How do you know, or what symptoms would you have if you suspect you might have sleep apnea that would take you to a specialist like yourself to get tested?
Well, there's a number of things that happen. If you're snoring and you have high blood pressure, cardiac disease, cardiac arrhythmias, gastroesophageal reflux, shoulder problems, because people with apnea, they sleep on their shoulders to get the tongue to fall away from the back of the throat and open the airway, and then they compress their rotator cuff and they start to get rotator tears or impingements. And then they get the repair done. They have to sleep flat on their back. When they sleep flat on their back, guess what happens? Their snoring gets worse and they get more tired. People with depression, because if you knock out REM from your apnea, you're more likely to get depressed or get anxious or irritable, because REM is where you process your stress and REM is where you consolidate memory. So even patients with memory problems that snore sometimes come to see me, because treating the apnea can help their memory. So there's a lot of different things, but excessive sleepiness, snoring, the inability to fall asleep on your back anymore, these are all signs that you may have apnea. Waking up with a headache is a real good sign, because if your oxygen drops low enough that the blood vessels have to dilate to let more blood into your brain to keep you from having a TIA or a stroke, then you're going to wake up with a headache. And patients will often come to me and say, I get a headache when I wake up in the morning, I take a cup of coffee and it immediately goes away. That's because the caffeine acts as a vasoconstrictor and then the headache disappears. So there's all sorts of little things that we look for. When patients are snoring and they're under care for depression, psychiatrists will refer the patients to a sleep specialist just to make sure that there's not any apnea.
And so you would do a sleep study and determine, in fact, that they're waking up a couple times a night.
They're stopping breathing.
Stopping breathing.
They may wake up a lot of times, and that may be something else, but they're actually stopping breathing, or the breathing is slowing down so much that their oxygen levels are diminishing.
And so they need a machine then to help in the obstructive sleep apnea case.
And in our practice, we try to get everybody on a nasal mask or an under-the-nose mask to start because they're easier to use, they're smaller, people are claustrophobic, don't have trouble with them. And the masks have improved dramatically over the past 10 years. When I first got into the practice, there were maybe 6 masks total. There are probably 50 different types now. And we generally can find something that the patient is comfortable with. They wear the mask, they use the machine every night, all night long, and if and when they take a nap.
And that helps keep them away, or keep them in slumber.
Well, it actually allows them to sleep, because before it wasn't sleep, they went to bed and had a disease. That's why they're waking up tired. They're waking up unrefreshed, or they're waking up feeling achy with their poor concentration and or sleep lethargy. Sleep lethargy is that feeling when you're so tired, it feels like your limbs are heavier, and you wake up and you can barely move them.
It's important that we pay attention to how we're sleeping, isn't it?
That's right.
Yeah. All right. Thank you so much.
You're
Good
welcome.
information. We'll be right back.